Tutti. Mi presento, sono Angelisa Picciolo, consulente EBSCO per il centro-sud Italia e Malta. Alcune comunicazioni di servizio. Abbiamo mutato tutti i partecipanti per evitare rumori di sottofondo. Per qualsiasi problema o comunicazione potete utilizzare la chat in basso a destra. La sessione verrà registrata, nei prossimi giorni riceverete il link di registrazione alla vostra mail. Alla fine del webinar verrà dedicato del tempo ad eventuali domande o commenti che appunto potete scrivere nella chat in basso a destra all'host. Se vi occorre un attestato di partecipazione potete chiederlo scrivendo a infoitalia@ebsco.com. Ringraziamo Roohana Khan, Academic Solution Consultant dell'American Psychological Association, per essere qui con noi oggi. Thank you, Roohana. Roohana ci parlerà della mission e degli obiettivi dell'American Psychological Association, delle sue iniziative e delle risorse disponibili sul mercato. Per qualsiasi informazione potete contattare i referenti della vostra zona . Ricondivido lo schermo. Ok, il consulente della vostra zona, io per il sud e il centro Italia, Emilia Quercia per, scusate, il sud Italia e Malta, Emilia Quercia per il centro Italia e Silvia Canavesio per il nord. Grazie Roohana, passo la parola a te. Roohana, you can go.
I can start. Thank you. Thank you. Okay, so let me go to my English presentation. Well, welcome everyone, and thank you for taking the time to attend this presentation from the American Psychological Association. Thank you for the introduction, Angelisa. So as Angelisa mentioned, I am the Academic Solutions Consultant for American Psychological Association. I manage the sales and negotiations for their library licensing business outside of US and Canada. And so today we will talk about, give a little bit about background and APA's mission. We are a society, not-for-profit society, so we do have a very important mission. I'll talk a bit about our sustainable development goals, which go in line with the, the global 17 goals developed by the UN, and how we are addressing good health and well-being. I'll talk about some international initiatives, our research products that help us to meet our mission and our initiatives. And we'll talk a bit about an important subject for librarians, about subject indexing, how it happens, what goes on behind that. So some background, and I'll give some search examples, and then we'll have some time for questions and answers. So background and mission. APA was founded in 1892, and it initially started with only 31 members back then, and now it has grown to 121,000 members globally. And we are the largest psychological organization in the world. Yeah, and I mentioned members from all over the world. Our mission, as I mentioned, we're a not-for-profit organization, and we are a mission-based organization. And the mission is to promote the advancement, communication, and application of psychological science and knowledge to benefit the society and improve people's lives. And so we do this by several ways. By utilizing psychology to make a positive impact on the many critical societal issues, by preparing the discipline, the field of psychology, and the profession of psychology for the future. We also do this by evaluating public's understanding of regard for and use of psychology. And we are constantly strengthening APA's standing as an authoritative voice for psychology. So as I mentioned, APA plays a big role in the UN Sustainable Development Goals, and APA plays a role in that. And some of the things that we are doing is that APA has an actual accredited, we have representatives at the United Nations working with other NGOs, UN staff, and with representatives of member states we do this to expand the understanding of psychology, again, going back to the mission, and to make psychological science accessible to key decision makers, and use psychology's unique contributions to health and human welfare, human rights, science and technology, and public policy to advance the 17 United Nations Sustainable Development Goals. There are 17 goals, and actually, it's our role in that is not just about good health and well-being, but we really do touch on all of those 17 in some way. Psychology is so broad; it touches everything. So it's gender equality. It's it's about partnerships for other goals, and peace and justice, and making stronger institutions. So it touches on all the 17 in some way. APA, as I mentioned, have a team at the United Nations with an aim to advance global mental health through APA's strategic plan, which is a laid out, clear plan with a particular focus on utilizing psychology to make a positive impact on critical societal issues, such as embracing global perspective and respecting and promoting human rights. So some of the recent activities that we at APA have participated in February, APA responded to the World Health Organization's requests for information on community-based mental health services. In March, APA provided input to UN on rights of migrant children. In April, APA co-sponsored a Psychology Day at the United Nations. So there was constant activity going on with the UN. Some projects that we have something called the Safe and Supportive School Project, which develops resources for school counselors, nurses, psychologists, social workers, and others to improve the school climate, to help things like youth development, school connectedness, parent engagement in schools, etc.
Sorry to
Yes?
interrupt you. Remember to tell me when to the slide.
Yes.
Thank you.
Where are you now? I forgot about that.
I am at the right place.
Number 11.
Supportive School Project.
Okay. So now I'm on guiding future clinical practice slide. Let me look at your screen. Then that way we're sorry. Yeah, that's it. Perfect. So, so guiding future clinical practice is APA's way of translating psychological research into evidence-based guidelines for practitioners. It is influential in health insurance coverage policy, which might be more US specific. You don't have to deal so much with health insurance, private health insurance in Italy, but we do play a role in that to ensure that play a role in that there's fair coverage policy. And the topics include adult post-traumatic stress disorder, PTSD, child and adolescent obesity, also maybe another US issue, obesity part, and also depression across the lifespan, which is a global problem, depression. So that is some of the things that we are APA is doing. Okay, next slide. Some of the things that APA is doing in the improvement of treatment of post-traumatic stress disorder is offering resources for mental health professionals, for primary care providers, for patients, and for families. Next slide. APA is also addressing mental health needs of racial and ethnic minority children. And this is being done by APA translating psychological research into practical, usable products for multiple audiences, such as guide for practitioners, policy brief for state and local administrators. Next slide. So some other APA international initiatives are that APA participates in something called a signed Memorandum of Understanding, or MOU. This is a partner program that formalizes relationships with national psychology associations with signed memoranda of understanding to signify a joint commitment to sharing resources and information, developing opportunities to collaborate, and for sustainable product alliance. So basically, this is in many countries where APA is working with their psychology societies in that particular, this particular regions to share our resources and create a dialogue and exchange of ideas. Okay, next slide. Some other APA international initiatives is that in 2020, APA awarded for distinguished contributions to the international advancement of psychology. So the two noteworthy recipients were Niels Peter Rygaard, who is a clinical psychologist licensed by the Danish Psychological Association. And so he is, he serves as a consultant and external expert for government agencies in Denmark and abroad. And the other recipient was Dr. Sharon Horn, who is a professor of counseling psychology and director of training for the counseling psychology PhD program at the University of Massachusetts in Boston. But she has provided extensive, since 2012, she has provided extensive leadership as an elected APA representative to the International Psychology Network for her work in the LGBT work and the lesbian, gay, bisexual, transgender issues. So she's a highly respected leader in advancing liberatory international psychology through integration of cross-cultural social justice and transnational feminist counseling psychology in her teachings and her work. So, okay, next slide. So now I want to talk a bit about the APA research products. APA, well, psychology touches everything. Although it is grounded in science, it has broad, it has boundless applications in everyday life. It touches on many other disciplines. It has clinical aspects, biological, applied, social, environmental. So it's a very broad subject area that touches on many other disciplines. So our resources we can categorize them in 4 different ways. The first is where, did I say next slide? So we're talking about resources now, sorry, Angelisa. Let me just make sure you're on the right slide. Yes. Search and discovery is where it begins. These are our abstract and indexing resources. And we have 2 databases that fall under this. So one is called, the database called APA PsycInfo, and the second one is PsycExtra, and I'll talk more about them in next few slides. And then we have another database that's more for streaming videos. And these are psychotherapy videos. We have a video of over 500 of these streaming videos called Psych Therapy. And these are actual live, real life kind of a therapist and patient interaction. That these are actual people that have agreed to be videoed for teaching and research purposes. And then we have our full text products, resources. These are our books and journals databases. These are essential peer-reviewed book chapters and journal articles spanning the behavioral and social sciences research. These databases are APA Psych Articles, which is our journals, full text journals database. And we have Psych Books, which is our full text books database. And then these next two products, e-collections and handbooks in psychology, those are all available part of the Psych Books subscription. But they can be purchased separately. However, you can find them if you have Psych Books on EBSCO. You will find all of our books, most of our books actually, and our handbooks in the Psych Books subscription. And then we have a product called Tests and Measures, which is an extensive collection of psychological measures, scales, surveys, and other research instruments that students and faculty can use. Next slide. So now I want to talk a bit more about subject indexing. EBSCO, on EBSCO platform, you will see it called as subject indexing. We call it index terms, index terminology. But it's the same thing. So when I use index terms in my presentation, it's the same thing as subject indexing. So we'll talk a bit about using an example of doing research to support good health and well-being, and show some examples of how to do that. But it's important to also mention, again, psych info here, because so much of this goes, this is where your research should begin for a psychology student or a researcher. So the index terms play a big role in psych info search. So psych info is a comprehensive abstracts and indexing database spanning the behavioral and social sciences. It gives access to 4.8 million records from 2,300 journals, includes 66,000 book chapters and 545 videos that I mentioned that were from that psychotherapy videos database. It's updated 2 times a week. It has journals in 30 languages and publications from over 50 countries. So it's quite vast. And coverage date going back to the 1600s. Next slide. So now a little bit more about APAs, the subject terms, or as we call them, index terms at APA. APA sets the standards for the APA thesaurus of psychological index terms. And this allows for enhanced search and discoverability across APA databases. It provides a precise and consistent terminology reflecting changes within the behavioral and social sciences. In 2019, we added over 300 new terms, and then this year, up to July, we added 102 new terms. So it's constantly growing, and I'll explain a bit more what goes into adding these terms. So how does the thesaurus help with searching? It standardizes the vocabulary. And it enhances the search precision, recall, and comprehensiveness. It allows for a more improved discoverability and learning, and it allows for facilitating data storage and retrieval, and it enables data analysis and visualization, and provides a better overall use of the data. Next slide. What do these additional, or where do they come from? There is some science behind it. So there's a lot of work that goes into in terms of how these terms are included. So they come from APA Psych Info indexing staff. We do have a staff that is dedicated just to doing this. So they are involved in the production system, suggested term field, and the term usage. We also depend on users, other users from that are using our databases based on their search query input. We also include them based on journal coverage. from new acquisitions of other journals that we are adding to the database, and other related sources as well, such as publications from other publishers, social media, and subject matter experts. And also from content searches, searches that come from APA databases, products, and web pages. Next slide. So some of the new terms that have been added in July 2020, and obviously the big thing right now is COVID-19 pandemic. So terms such as coronavirus, disease screening, physical distancing, public mental health, and quarantine, new and very 2020 kind of terms. Also terms related to health, such as health awareness, healthy aging, preventive health behavior, public health attitudes, rural health. And then social issues and social psychology. So you get the point, just to show an example of how these new terms are added and how it looks. So that is an example of what's been added in July. So I wanted to kind of do, next slide. Just slow down a bit to make sure. Okay. Sorry, I just went too far. 1 minute, I kind of lost my track here. Okay, so some examples of using the APA thesaurus to add index terms. So this is when you're actually doing a search in EBSCOhost. So here I've taken a screenshot of APA PsycNet database, but the search is the same, whether you do EBSCOhost or any or ours. So it does not matter that this is from APA PsycNet. When you're searching on EBSCOhost, it would be a similar sort of search criteria that you would follow. So, for example, here I'm going to do I'm going to use APA thesaurus psychological index terms. Enter my subject here, which would be well-being, and then at the bottom you can refine your search further. And I have chosen what you see circled, resilience, psychological resilience, and child health. So I will stick to these as my two refined index terms, and then show what happens in the next slide. So next slide. So here now we are in the advanced search here. You will see that the index terms from the APA thesaurus, after they've been added to the advanced search screen, you will see these appear in what is in the circle on the right-hand side. You see index terms. They have all carried over. So now you will see your index terms here. And then, so now you are ready to execute the search. Okay, next slide. And here, the search results, we see that on the tabs on the top, you see all. So that is 16,331 results that I received from this search. And you will still continue to see the index terms in the parentheses, resilience, psychological, or child health. And on the very top, you can see the results from the different databases. So for example, PsycInfo, based on the search, there are over 13,000 results, PsycArticle 768, PsycBooks 124, so forth. So you could click on those if you wanted to see, if you wanted to go to PsycArticles to see what are the full text articles from this results, then you would get just PsycArticles results here. If you clicked on PsycInfo, it would give you beyond what is available in PsycArticles. So this would be more your universal results that you would get in PsycInfo. So also on the search of results, but you can refine by search results by location. So you see filter results on the left. So you could refine by geographic location, for example. When I was playing around with this, I chose Italy and I had 120 results from Italy, which I'm not showing here, but just an example of how you can further refine under filters based on how narrow you want to go with the search. Okay, next slide. So I'm gonna go back up here. Okay, so again, you can further narrow the results with filters. So for example, if I wanted to filter by age group, it would be an effective way to quickly find research related to children of certain ages. So if I wanted to get adolescents from 13 to 17 years, or childhood from birth to 12 years, you could further refine by that, and it will tell you by the age group, parentheses at the bottom. For example, for adolescents, you'd be able to find search results of 3,206. 2,914. So you can see what the results look like under those filtered categories by age. Or you can also use the filters on the search results page to set limit on the advanced search page, where all age group options will be shown. Okay, next slide. Your users can also narrow results with classification codes. So classification codes are more high-level research, and these codes are assigned by highly trained APA staff to categorize at a very high level, as I mentioned. And for example, in our search example that I use, these are the classification codes assigned to the search results. And you can further filter by classification codes on the search results page or on the advanced search page. So at the bottom in that little graph, you see filter, and on the right-hand side are all the options. So those would be another way to filter further by these classification codes. And so these are some of the classification codes that, just an example, a screenshot on the left, on the right-hand side, just some examples of that. Okay, next slide. So using these classification codes, for users looking to find test search results, they can filter by test construct or test and measures. And clicking on these filters will limit the results to the number of records in parentheses. So on the right-hand side, you'll see that these are the results. So this is helpful because it relates to tests that are included in APA Psych Info. But access to APA Psych tests is not required for the researcher to view the bibliographic information of these tests. They can still view them, even if they don't have access to psych tests, but they will know what is out there. And so this will allow them to see this information. Okay, next slide. And so these are the final results. So we filter down all the way to what we wanted, and we can the researcher can then choose that they want to get tests and measures. On the top tab, Psych Tests is circled, so they can choose that to find the results. There are 268 narrowed results. And then, so these are some of the things that are going to come up: school resilience scale, illness perception and functional disorders, for example. And so this would be the refined search results, and they can further refine them if they want to really narrow this down further. On the left-hand side are filter results, where they can narrow down by author, as I mentioned earlier, age group, population group, instrument type. So it can be narrowed down as much as is needed to get to the precise research that they need for their work. Okay, I think that covers the presentation of what APA does and our mission and the resources that we offer. We do offer webinar trainings. If you wanted something more in depth, my presentation here was very much just a PowerPoint presentation, but we offer more live demonstrations where we have a support team that does webinars using the actual platform. So they can train on using EBSCOhost platform and to show you actual live search examples of how to navigate the platform and how to do searches. So we have standing webinars, and here are some of the webinars that we have coming up in October and November. They're on US East Coast Standard Time, Eastern Standard Time. So maybe some of these are a little late, but 10 a.m. is doable, I think, for Italy. However, if you wanted a more customized webinar, let EBSCO know, and we can organize that with somebody from our team in Washington, D.C., where they can do that webinar on EBSCOhost, showing some of the things that I just showed with the search. But I think it is better when it's done live, going through the actual platform. So that is an option that you have to come back another time for a more customized training on EBSCOhost. So thank you for supporting APA. We are very appreciative of your loyalty. Many of you are subscribers of APA databases. And if you have any questions, you can always contact me, or you can contact me through EBSCO. So now I will leave it for any questions that you might have.
Roohana, thank you very much.
Sure.
Thank you. Grazie a tutti. Se avete delle domande aspettiamo qualche minuto per darvi il tempo di scriverle nella chat. Nel frattempo ne approfitto per ricordare il prossimo appuntamento dal titolo Evoluzione e sviluppo, trend di ricerca e soluzioni EBSCO, che si terrà il 15 ottobre alle 11 con Gianluca Di Bella, Vice President of Sales EBSCO. Vi ricordo ancora che nei prossimi giorni riceverete una mail con il link alla registrazione di oggi e se avete bisogno di un attestato di partecipazione potete richiederlo scrivendo a infoitalia@ebsco.com. Intanto tolgo la condivisione e aspettiamo qualche secondo se non ci sono domande. Roberta De Martino, say all clear. Thank you.
Mm-hmm.
Say you've been all clear. Thank you.
Hopefully everybody understood, okay?
Ok, allora ringraziamo tutti ancora per la partecipazione. Grazie anche a Roohana per essere stata con noi oggi. Thank you, Roohana.
Thank you, everyone. Thank you.
Have a good day. Buona giornata a tutti.
Okay, bye. Thank you.
Bye.
Bye.
Arrivederci.